Masturbation, it's one of the most common behaviors men engage in but least talk about. Often shaped by hearsay or taboo discourse, this topic is actually an integral part of men's health from adolescence to old age. So what's the truth? Does masturbation slow down development, lower testosterone, or damage relationships? Or, on the contrary, is it a hidden supporter of masculinity? From prostate health and sleep patterns to self-confidence and stress management? Hello, I'm Dr. Lyra Benton. Welcome to my channel where I focus on urology and men's health. Numerous studies, from the American Urological Association to the World Health Organization, provide clear answers to these questions. Even more interesting, the impact of masturbation changes with age. It becomes a source of discovery in adolescence, control in your 20s, a health shield in your 40s, and an unexpected source of vitality in your 60s. Today, we're revealing the mysteries of this secret journey. If you're ready, this adventure, which will make you question everything you thought you knew, begins. We begin with masturbation in adolescence. With increasing hormone levels during adolescence, sexual curiosity and urges intensify. During this period, the majority of male adolescents explore their bodies and the feeling of sexual pleasure through masturbation. There is no strict recommended frequency. Frequent masturbation due to high desire is normal. The important thing is that it does not disrupt studies, social life, or daily activities. Physical sexual health. There is no scientific evidence that masturbation during adolescence negatively impacts physical development or reproductive health. Regular ejaculation reduces sexual tension and helps young people identify their sexual responses. Even without masturbation, natural ejaculations, such as wet dreams, occur. The WHO defines masturbation as part of healthy sexual development during this period. Psychological dimension. Guilt can develop due to social taboos and misconceptions. A non-judgmental, informative, and confidential approach from families is crucial for a young person's self-confidence and mental balance. Masturbation reduces stress and anxiety, contributing to psychological well-being. Caution. Overly harsh and intense techniques can cause local irritation. Excessive activity that disrupts daily functioning may indicate underlying stress or obsessive tendencies. In such cases, professional support may be helpful. Masturbation in young adulthood. The 20s are the period when sexual urges are at their highest in men. Daily masturbation is considered normal, especially for single men, while the frequency may decrease but not disappear completely in those with a partner. Masturbation during these ages contributes positively to understanding sexual experiences, reducing stress, and improving sleep quality. Evidence-based physical sexual health. Masturbation does not permanently affect sperm count or testosterone. After ejaculation, sperm count drops temporarily and returns to normal within a few days. The AUA states that masturbation during these ages is not harmful to reproductive health, but rather supports the healthy functioning of the reproductive tract. Psychological dimension. Masturbation during this period increases an individual's sexual self-confidence and facilitates communication with their partner. However, excessive pornography use can pose a risk of addiction and lead to satisfaction issues with real partnered sex. Things to consider. Masturbating frequently enough to disrupt daily functions or constantly engaging in pornography may be a sign of addiction. In this case, the behavior needs to be rebalanced. Variety and moderation are important. When it comes to masturbation in middle ages, in your 40s and 50s, libido may decrease compared to youth, but masturbation is still a healthy behavior. For single men, engaging in it several times a week is common. For those with a partner, the frequency varies depending on the couple's lifestyle. During this period, masturbation helps reduce the stress brought on by intense work and family responsibilities. Physical sexual health. Regular ejaculation has positive effects on prostate health. Harvard research shows that frequent ejaculation may reduce the risk of prostate cancer. The World Association of Urology also states that regular ejaculation supports prostate function. Furthermore, regular sexual activity helps maintain erectile function. Psychological aspect. Masturbation can be a relaxing way for men in middle age. If there is open communication between partners, it does not harm the relationship and can even be a complementary element for some couples. Things to consider. Turning entirely to masturbation instead of partnered sex can be a sign of relationship problems. Pornography addiction is also a risk factor in middle age. Masturbation, when done in moderation, is beneficial during this period. Now, finally, let's look at masturbation in older ages. Although testosterone levels decline after age 60, sexual desire doesn't completely disappear. For older men in good health, masturbation is a safe and natural way to satisfy their desires. Frequency varies from person to person. The key is finding the right balance for their body. Physical sexual health. Regular ejaculation is thought to reduce the risk of prostate cancer, support the immune system, and contribute positively to sleep patterns. The WHO considers maintaining a sexual life beneficial for overall health, even in older individuals. In men experiencing erection problems, masturbation can help maintain tissue function by increasing blood flow to the penis. Psychological dimension. For older men living alone, masturbation can play a role in alleviating emotional loneliness. The hormones released during orgasm contribute to stress reduction, improved mood, and improved sleep quality. Precautions. Skin becomes more sensitive with age, so using lubricants may be beneficial. Men with heart, prostate, or other serious health problems should consult their doctor. Masturbation in older adults is generally considered a harmless and beneficial behavior. Now, let's examine the effects of masturbation on hormones, testosterone, and reproductive health. Masturbation does not permanently lower testosterone. Short-term fluctuations may occur at the time of orgasm. It has no significant long-term effect on baseline levels. Long periods of no sexual activity may be associated with a decrease in testosterone. For reproductive health, reasonably frequent masturbation supports sperm quality and the regular functioning of the reproductive cycle. It does not impair fertility. In couples wishing to conceive, abstinence for a few days before intercourse can temporarily increase sperm concentration. This does not mean that masturbation is harmful. So, are there any psychological effects and potential for addiction? Masturbation is not only a physical release, but also a behavior that affects mental balance. It has direct and indirect effects on a man's quality of life. Here are the psychological effects and potential risks from a broad perspective. What are the positive effects? One of the most well-known benefits of masturbation is its ability to reduce stress. The hormones dopamine, serotonin, and oxytocin released during orgasm reduce tension, improve mood, and create a kind of natural antidepressant effect. Therefore, regular but moderate masturbation plays an important role in alleviating the pressures and anxieties of daily life. It is also beneficial for men experiencing sleep problems, as the hormone prolactin released after orgasm facilitates the transition to sleep. Furthermore, as men become more aware of their own bodies, they gain sexual self-efficacy, which leads to greater confidence in partnered relationships. Research on male-female relationships has shown that men who are aware of their own bodies communicate more easily in bed. So, does it have negative effects? However, masturbation can also lead to negative psychological feelings due to misinformation and social taboos. Especially during adolescence, young people can develop guilt and shame when faced with terms like shameful, sinful, harmful. This can lead to self-esteem issues and a lack of enjoyment of sexuality later in life. Although scientific data repeatedly demonstrates that masturbation does not slow development or impair health, the psychological pressure created by false beliefs creates a significant burden. Therefore, providing accurate information to families and the education system is crucial for young men to develop a healthy perception of sexuality. Potential for addiction, superstition, and attraction. Another dimension of masturbation is the risk of addiction. Normally a healthy activity, this habit can become problematic when combined with a loss of control. Frequent masturbation that disrupts daily functioning, impacts social relationships, or work-school performance can be a sign of underlying stress, anxiety disorders, or obsessive tendencies. Especially when combined with heavy pornography consumption, the brain's reward system is disrupted. Because dopamine receptors are overstimulated, sexual intercourse with a real partner becomes less satisfying. This can lead to performance anxiety, premature ejaculation, or erectile dysfunction in the long term. This condition, called pornography-induced erectile dysfunction, is increasingly reported in the psychological literature. The American Psychological Association, APA, states that psychotherapy and, when necessary, medical support are effective in treating these types of addictions. The healthiest way to self-monitor is to ask a simple question. Is masturbation disrupting my life? If the answer is yes, this is a warning sign, and balance needs to be restored. In summary, masturbation is a natural and healthy part of men's sexual lives from adolescence to adulthood. The process of curiosity and exploration that begins with the surge of hormones in adolescence continues with the most intense urges into young adulthood. During this period, masturbation becomes one of the most effective ways to cope with stress, improve sleep quality, and gain body awareness. In middle age, masturbation offers biological benefits, from maintaining prostate health to maintaining erectile function. It also becomes a means of relaxation amidst intense work and family responsibilities. Even as testosterone declines in older age, masturbation remains a safe and satisfying way to support immunity and mental balance. The scientific data is clear. Masturbation does not permanently lower testosterone, does not impair sperm quality, and does not negatively impact reproductive health. On the contrary, when practiced reasonably often, it supports both the body and the mind. However, when used excessively, and especially when combined with intense pornography, it can lead to addiction. This can lead to withdrawal from real partnered sex, performance anxiety, and erection problems. The key is to maintain a healthy balance with masturbation. Remember, the information I share here is for general health and educational purposes only. Masturbation is a natural and healthy behavior from adolescence to adulthood. The important thing is to know moderation and not disrupt daily life. While scientific data demonstrates its benefits, the real danger lies in the guilt created by misguided beliefs. True self-confidence shines in a man who knows and respects his own body. If you found this video helpful, don't forget to like it, share your thoughts in the comments, and subscribe. Stay tuned for the next video, which will surprise you with exciting topics